Today we will be discussing case scenario, headache and dizziness in a 54-year-old man. Now we have to understand it is crucial to know the age and the sex of the individual, as those can help us diagnose, seeing that some diagnoses occur more often in men than women, while others happen more in older people than younger people. And race can also play a factor, but that is not discussed in this case. In this case, the person in question seems to be dealing with headache and dizziness. Now, they have been previously diagnosed with classical migraine, but this is different because it is more of a throbbing, dull pain. And though for migraines, sumatriptan seems to help, it is not helping in this case. Now, they are also dealing with tinnitus as well as potential hearing loss in the right ear and vertigo, causing dizziness and creating imbalance when they bike or walk, which is leading to lower back pain as they are unable to exercise. Now, a past injury that had led to concussion and post-concussion syndrome could be an issue, but as for vitals, everything seems normal, and we will now be looking at the test results. Now, as for HEENT, the Weber test showed that there is potential hearing loss in the right ear due to lateralization to the left ear. And the Rhine test, the bone conduction test, showed that the issue is most likely in the outer or middle part of the ear. Now, audiologic evaluation showed that there is some hearing loss and it is causing difficulty recognizing speech in the right ear. Tinnitus handicap inventory score came to a whopping 65, grade 4, which means it is affecting his quality of life and creating an issue. Now, MRI of the head with contrast showed a 2 centimeter mass at the internal auditory meatus, which is normally where cranial nerve 8, the vestibulocochlear nerve, is located, which could be an issue. Now, medical terms that we have to keep in mind: labyrinthitis and acoustic neuroma are potential diagnoses for this individual. Labyrinth, meaning inner ear, is the word root, as itis means inflammation, is the suffix. And so this is inflammation of the inner ear. Now, acoustic neuroma being two words: acoust meaning hearing is the word root, ic being pertaining to is the suffix, nerve being nerve is the word root, and oma is the tumor, meaning and is a suffix. Now, acoustic neuroma refers to the tumor that, again, it can be found in cranial nerve 8 and affects balance or hearing. Now, as for glioblastoma, that is something his cousin died from at 24. Glee, meaning neuralgia, is the prefix. O is the combining vowel, and blast means immature cell, which is the word root. And oma, again, meaning tumor, is the suffix. And this is an actual fatal tumor that arises in the brain due to immature glial cells, or immature glial cells. Now, abbreviations are HEENT, head, eyes, ears, nose, and throat, BP, which is blood pressure, and MRI, which is magnetic resonance imaging. Now, as for differential diagnosis, acoustic neuroma is the most likely. As defined earlier, it is a tumor in cranial nerve 8, which was seen in the MRI. Now, common signs persist and go along with this 54-year-old man's, symptoms. He is 54, and this happens normally in people with 40 to 50 years of age, and it only occurs on one side most of the time, which is true for this individual. It's on the right side, and it has been creating hearing loss as well as tinnitus, balance problems, vertigo, and dull headaches, all which point to acoustic neuroma. And as for these other potential diagnoses, it is most likely none of these, due to there being no infection, no blocked vessel, and no previous signs of cancer. And as for migraine medication is not helping with this. Now, the significance in medical terminology goes a long way. There are ethical standards of patient care that are held by medical terminology. Looking at specialists, we use medical terminology in order to help people understand what is going on, and it provides a certain amount of autonomy when people get to choose what they want to do. Now, let's say someone gets an MRI done from an ortho specialist and they are able to read the report to them, but maybe they want a second opinion, and now they're able to take that same report with that same terminology to a different specialist because this language is universal. And this allows people to make decisions and get assistance elsewhere if needed by their own choice, by whatever they want to do. Not only that, but it leads to other sources of professionalism and integrity. Medical terminology is a professional language, and it is a type of language in the medical specialty, and it is world renowned. Everywhere, anywhere you go, most likely the medical terminology will be there. And with my patients, I am a medical translator. A lot of them take their MRI reports out of the country when they travel to India and are able to show specialists there and get the same type of assistance because this language is understood everywhere. And not only does that show professionalism, but now there is integrity because these people are able to take their needs elsewhere. They're able to be heard and understood by any specialist around the world, or even different specialties as listed here. Now, these are the resources used for my presentation, and I hope you have a great day.